Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Many people are on multiple medications, but do they interact well together? Well, on today's show, we're going to be joined by the Vice President and Chief Pharmacy Officer at Baptist Health South Florida to answer your questions and offer you tips on how to make sure the medications that you are taking work well together, and more importantly, that they won't hurt you. That is all coming up on this episode of Ask the Doc, No Appointment Needed. Hello and welcome to Ask the Doc, No Appointment Needed. This is the show where the health questions you send in are answered by our doctors and medical experts. And thank you so much for joining us today. I'm Julie Donaldson. I'm so pleased to be joined by Dr. Madeline Camejo, the Vice President and Chief Pharmacy Officer at Baptist Health South Florida, and Dr. Maria Pulido, Ambulatory Clinical Coordinator, also from Baptist Health South Florida. Ladies, thank you so much for your time and joining us today.
Thank you.
Hello, happy to be here.
Yes, we have a lot of really great questions coming up. So let's just get right into this, okay? First up, we have Freddie emailing in, and she asks, my doctor mentioned drug-to-drug interaction. I think I know what she means, but I'm not sure. Can you explain what that is and what I need to know to stay safe? Now, Dr. Camejo, let's just start right off with you. I know a lot of people out there have many similar questions. So what do you say to Freddie?
So, Freddie, a drug-drug interaction usually occurs when two or more drugs react with each other and potentially alter the effectiveness or the safety of the medications involved. And sometimes it can lead to unexpected side effects or change in how the drug works. Now, there are other types of drug interactions as well. It's not just drug-drug, but there are drug and alcohol or drug and food, as well as even drug and supplements. But hopefully, we'll be able to discuss all of these types of interactions today.
Yeah, we have some of those coming up, so we'll get to them as we move along here. Now, Dr. Pulido, this next question comes in from Aaron, and he writes, I like to drink wine with dinner when I go out and at home occasionally, and I am taking Valium to help me sleep at night. Is there a risk in doing that? Now, Dr. Pulido, I think we know what the answer is here, but what do you say to Aaron?
So that's a great question, Aaron. And I'm sure that it's a question that it's in everyone's mind. So yes, there is a risk because Valium works by slowing down the brain and the nervous system. And so does alcohol. That is why we counsel our patients not to drive or operate heavy equipment. And we do not drink and drive. When you drink alcohol and take Valium, this effect is significantly greater, and you can feel sleepy, dizzy, confused, and in even more severe cases, depending on how much you have had to drink, even have trouble breathing and lose consciousness. Just as a general rule, my recommendation is not to drink Valium with alcohol.
Yeah, so maybe if you're having the alcohol, just skip the Valium that night until it becomes more standard in your day to not have the alcohol. Don't mix them. It's too risky. Our next question here, it comes from Vicky, who reached out through Facebook, and she writes, I take calcium and magnesium supplements and was just prescribed an antibiotic for an infection. Now, is there a problem taking those together? Dr. Camejo, can Vicky take these together?
Well, first of all, it really depends on the antibiotics. But antibiotics like Cipro or Levaquin, there can definitely be an interaction. In general, calcium or magnesium or even other minerals are not recommended to take with antibiotics at the same time. As you know, antibiotics are used to treat infection, but when you're taking it with these minerals, they can bind together in your stomach and make it harder for your body to absorb the antibiotic properly, leading to reduced effectiveness of the antibiotic. So your infection may not get treated as well as it should be. So there is a way that you can still take your supplements while you're on antibiotics. And one is by taking your antibiotics 2 hours before you take your supplements, or take it 6 after you've taken your supplements. So this way they don't really interact with each other.
All right, we want your questions and we have more to get to, so let's keep it going. Our next question comes in from Christian, and he writes, is there a problem with me drinking a few beers while on an antibiotic? My wife says that I should not, but I think that is an old wives' tale. Dr. Pulido, look, we've heard this for years, right? But is it an old wives' tale like Christian suggests?
Another great question. And no, it is not an old wives' tale. So some antibiotics can actually lead to a severe reaction when taken together with alcohol. For example, when alcohol is taken together with an antibiotic called metronidazole, patients can experience severe nausea, vomiting, palpitations. And because of this, it is recommended that patients taking metronidazole do not drink any alcohol while they're taking the antibiotic and for 3 days after complete discontinuation. I had an interesting case a couple of years ago. I had a young man in his mid-20s come in to pick up a prescription for metronidazole. I went through the usual counseling, explained how to take it, the importance of finishing the full course, gave a very strong warning about avoiding alcohol during treatment and for the 3 days right after discontinuing the medication. He nodded, said he understood, seemed genuinely on board. Now, you fast forward a couple of days, I was doing my routine follow-up calls, and when he answered, he sounded just awful. I mean, it was a raspy voice, low energy. I asked how he was doing with the medication, and after a few seconds, he paused and he admitted, I took the pill and then had a drink later that night, and I've never felt worse in my life. I empathize with him. That reaction, it's not fun. It was a tough moment, but also a really powerful reminder that people sometimes do not realize how serious these interactions can be until they experience them. In the case of other antibiotics, when they're taken together with alcohol, they may not work as well. And as a result, people might take longer recovering from an infection. Therefore, I never recommend drinking alcohol while taking antibiotics.
Yeah, that sounds like a terrible place to put yourself in. I understand people want to stick with their normal routines. They're probably going out and socializing, but when you're on antibiotic, it sounds like it's just not worth the risk as we move on there. So thank you for that answer, and I hope they actually hear and listen to you, right? Well, next we're going to hear from Travis, who writes in, I'm on a medication for my thyroid. Are there foods that I should avoid or eat to improve absorption of the medication? So Travis, thanks so much for your question here. Dr. Camejo, what foods should Travis eat, or more importantly, what should you stay away from?
So when taking levothyroxine, your diet can significantly influence how well your body absorbs the medication. So there are foods that interfere with absorption and it should be avoided for at least 4 hours before or after taking your medications, like soy products. You shouldn't be taking them. High fiber foods like raw grains or even raw veggies, fruits with skin. Calcium is another one. Foods that are rich in calcium like milk, cheese, or yogurt. Another one is coffee. People love to drink their coffee with their thyroid medication. That's a no-no. Any caffeine or iron supplements will reduce the absorption of your medication. So when taking, those types of medication, best practice is always take your thyroid med on an empty stomach 30 to 60 minutes before breakfast or anything else that you have to eat, and avoid eating anything during that window. And always space out any supplements by at least 4 hours after you've taken your medication.
Now, why are some of these foods forbidden? What is it about them?
They interact with the absorption of the thyroid. And so you need your thyroid for healthy function, for especially because a lot of people may not have a thyroid, or they have one that works partial. And so it just really makes the body doesn't feel good. The patient just doesn't feel good. So just, you got to make sure that you want to be able to absorb completely your dose while you're on your thyroid medication.
You mentioned some of those foods and beverages, but does it depend person to person as well? Or is that just kind of like a blanket, no matter who you are, what your blood type or what your body wants, these are things that you need to avoid?
No, these are things you need to avoid. These are like chemicals that mix, the type of foods that they are don't mix well with the actual medication.
Okay, I think we got that one there. Next, we're going to hear from Alice, who writes, I love to drink grapefruit juice in the morning, but I heard that if you're on medications, you should not eat grapefruits or drink grapefruit juice. Now, is that true? And if so, why? Dr. Pulido, I've never heard this. I love grapefruits, but I'm not sure where this comes from. So tell us, is this a good thing, a bad thing for somebody that's on medications?
Yes, no, and I'm the same. I love my grapefruit as well, especially in the morning. So yes, absolutely, I get it. But it depends. It depends on the medications that you are taking. Whenever you take a medication, your body needs to break it down so it can use it. Some of the key players that help with this can be inactivated by grapefruit. So you can think of grapefruit as it's stopping some of these key players from changing that medication into what it needs to be. So as a result, the concentration of common medications taken to decrease cholesterol, and this is just an example, such as atorvastatin and simvastatin, can end up being very high when taken together with grapefruit. And this can lead to toxicity due to increased side effects, such as muscle pain, weakness, dark color urine, feeling tired or unwell. And I'd like to share another example. This happened when I was on rotation as a pharmacy student. We had a patient come to the emergency room with severe swelling in his legs. I mean, this was severe. He couldn't even walk. And, he got all the tests done. And when these tests came back with answers, we realized that his symptoms were the result of muscle breaking down. It can be that severe due to taking simvastatin 40, which is not even the highest dose of simvastatin, and eating a grapefruit daily. And something similar can happen when patients take nifedipine, for example, which is a very common blood pressure medication, and then they drink grapefruit at the same time. So nifedipine levels can reach toxic levels, and patients can experience dizziness, flushing, which is like red or warm face, that's how it feels, the headaches, nausea, and in very severe cases, extreme weakness and even loss of consciousness.
So you're basically saying if you're on any of these medications, just stay away from grapefruit juice.
Yes. And it's important to check because depending on the medication that you're taking, it might have that interaction with grapefruit.
Oh, that's really disappointing for those that would love to have grapefruit with these medications, but better to be safe than sorry as we move on here. Let's keep it going. Charlie reached out on Instagram and he writes, I have been forgetful lately, so a friend of mine recommended ginkgo biloba as a supplement to help improve my memory. Is it okay to take it even if I am on an anticoagulant for AFib? Now, this sounds like a question that a lot of our viewers are interested in. Dr. Camejo, what do you say to Charlie?
So, Charlie, ginkgo biloba is great if you aren't on any medication. It usually helps folks for, help with focus and memory. It's one of the properties. But the problem is with ginkgo biloba, it also has blood thinning properties. So taking them together with an anticoagulant such as an Eliquis or Xarelto or even warfarin, the effect is much more pronounced. And so as a result, patients may experience an increase in bruising. If you hit your hand, things that you accidentally hit yourself in, you can see a big bruise appear, prolonged bleeding from a cut where you may have had a cut or even gotten injured. And in more serious cases, it actually can lead to both gastrointestinal or even leading to a brain bleed. So please make sure you don't do that. And before you do anything, especially with taking an anticoagulant, always talk to your pharmacist or doctor before you take any supplements with your anticoagulants.
Taking that, but the problem being the forgetful memory, is there something that they can take maybe instead of a ginkgo biloba? Or is there a certain time that maybe they should start thinking about taking something to help with that?
Well, I think depending, most people, how do you define I'm losing, memory? I mean, I think if that's the case, then you definitely need to go back and see your doctor. But if, using function, a lot of it is people aren't always resting. They're always looking at 500 different things. We're always so busy. It's very normal that people forget and can't focus on things. So I would always say, there's not, I would say, anything of a supplement that can help improve the memory. There are some nutrients out there that are out there for that. But always before you take anything, if you're on a medication, make sure you talk to your pharmacist so there are no interactions.
Well, we just got a question from Rachel, and this time from our Facebook page, and she writes, I am taking medication for my mechanical heart valve. Is it okay for me to take Advil or Motrin for joint pain? And what are the potential consequences of a drug interaction involving blood thinners? Dr. Pulido, are there concerns about taking a blood thinner and Advil or Motrin at the same time?
Great question, especially because we see Advil and Motrin just over the counter, so easy to have access to them. But in this particular case, taking Motrin or Advil in addition to a blood thinner, such as a warfarin, can lead to an increased risk of bleeding. Like Dr. Camejo explained, small cuts or injuries could bleed more than usual and might even have a harder time stopping. In more serious cases, it could even lead to dangerous internal bleeding. So when it comes to these medications, no, stay away and always ask.
Okay. Is there a solution? What would you recommend that they do in place of this?
If they do have that pain, I would definitely see a specialist, because there are also specialty medications that the patients might qualify for depending on their other conditions, let's say. But I would say, there's also Tylenol as well that could be taken over the counter. It doesn't help as much as inflammation, but it will help with pain.
Okay. Good advice. Next, we're going to hear from Sergio, who emailed in this question. I want to add supplements to my daily routine. Which ones do you recommend? And is there a concern that daily all-natural supplements can cause negative interactions the way that medications do? Now, this is a really good question. There's so many out there that you could take. Can there be a negative interactions between supplements? And then which supplements should people be taking?
So, Sergio, just like meds, you need to space out your supplements. Taking them all together may be a way of being convenient, but it's not always effective. And I just give you a couple of examples. Like some vitamins need to be spaced apart. And a perfect example would be like vitamin C. If you're taking a vitamin C and a B12, you shouldn't be taking them together. Why? Because the vitamin C will actually reduce the absorption of your B12. Another example are your what they call the, soluble vitamins like vitamin A, D, E, and K should be taken with foods so they can be absorbed better. And so for men, which I would want to add, and if you want to add supplements, then I would really recommend like a multivitamin, like a high quality multivitamin, which helps cover natural gaps in nutrition that we don't always eat the best possible. So this really helps men in that aspect. But, something like a Nature Made or a one a day, those are always good. Another vitamin for men would be like omega-3 fatty acids, which help support brain and joint health. Creatine, especially for muscle strength, ideal for active men and aging adults. Those are always great to do. Vitamin D and K, those are also help support bone health and testosterone levels and even helps immune functions. And maybe some magnesium, which helps add sleep as well and helps deregulate stress. And maybe some Q10, especially important for men who support energy production and help with heart health. But before you start, any kind of regimen, go see your pharmacist and make sure that they can help you put a regimen together that'll be safe and effective for all the meds you're taking, or all the supplements you're taking as well.
You mentioned a lot there. I feel like it can be a little confusing for somebody obviously going and talking to someone and seeing what they might need for their body. But can you just take one of those one daily multivitamins that they sell and will that get everything? Or do you need to go and see what else you might need to add in order to get what
it depends. A one-time multivitamin ain't going to do everything. Like if you want some more heart health, it all depends on what is the supplement regimen that you want to achieve for yourself. If you're an athlete and you want to do there are certain there are certain supplements that you do want to take to help improve performance. It's not going to be just a multivitamin. So depending on what you really want done and what is your ultimate health goal, then sit down. I would recommend sit down with a pharmacist and say, I want to protect my heart. A multivitamin may have some vitamins, but it doesn't do the things that you may want to do to do your overall health goal.
So the best thing is to start asking those questions like you
Absolutely.
just there to get the answers. Look, okay, we have more to get to. Let's keep going. Our next question comes from Raul, who reached out to us on Instagram, and he writes, you've been talking about dangers of drug interactions. What are some of the warning signs I need to look out for if medications and supplements that I am taking do not work together? Now, Dr. Pulido, are there some warning signs that Raul should look out for?
Absolutely. And I'm going to be very general, and then I will give some examples. But, it depends on the medication and the supplements that you are taking. I would say just look out for some minor symptoms, such as a rash, gastrointestinal upset. So again, this could be like a little bit of nausea. It just doesn't feel right. As well as some mental changes. All of a sudden, you feel a little bit more confused or dizzy. Other warning signs include new or unexpected bleeding. We have seen, as we have gone through some of the questions that depending on the medications, they could lead to that excessive bleeding, as well as signs of confusion, yellow skin, heart palpitation. So this will be more like those toxic kind of side effects. I will say also look for the loss of effect of some of your medications. So let's say you have been on a blood pressure medication for a long time, your blood pressure is controlled, everything looks good, but then you decided to start a supplement, and all of a sudden, that's the only change that you have made, and your blood pressure starts going up slowly. At that point, it could be because that supplement, it's interacting with your blood pressure medication.
Yeah.
Yes. And then I had a patient once who was also, some of them, yes, go ahead.
No. I would say I think that's a really great start. And it goes to show just how important this topic and the discussions are of if you have these questions, you've got to talk to your pharmacist, you've got to talk to your doctor, because there's so many risks of crossing things that may do a lot more harm to you than good. And we thank you ladies so much for your time, but we're out of time. So thanks so much for joining us for the Insight. I'm Julie Donaldson, and we'll see you next time on Ask the Doc. No appointment needed. Stay safe and be well.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.